Welcome again to one of my videos, Cases of Fish Diseases, case number 329, about the discus with a typical hole in the head erosion syndrome, lateral line erosion. Typical case for those that have discus or are breeders or importers. They have seen hole in the head disease or syndrome. It's not a disease because a disease determines exactly the pathogen related. In this case here, I found one specific pathogen which is the cause of the lateral line to break down. I have ideas about the reasons why the lateral line shows eroded. So you have the head-and-lateral-line-erosion or syndrome. And I have specific videos on that on you check on my YouTube channel on hole in the head disease of cichlids that can help you to understand. But here today it's specifically about a discus fish that shows clearly the symptoms or the signs of hole in the head syndrome, HITH, or head and lateral line erosion, HLLE, with parasites, Spironucleus. In my books, I have, particularly in the big book, specific chapter on hole in the head disease of cichlids and specifically also on discus. Some interesting details are available in there, how to prevent and certainly how to treat. Here is the discus fish. See the lateral line eroded and see the holes in the head here, above, and here, and here. Those are all part of the lateral line of the fish that is, well, covering the side of the body. You can see here the erosion, but also the head has parts of the lateral line organ. You can see the holes appearing. And it's not big yet, so they're not big holes. So the lesions are small, so the fish can be repaired. So there is no scar tissue left when you treat on time. Here I show you the photograph of that fish. You can see the holes here and the lateral line eroded. And that's the thing you must learn to observe as soon as possible. When you see that, take time for examination. Particularly take time to start checking the excrements. In this case, because there was a big load of discus fish had to be examined, and this had group of fish were all suffering, so I had to sacrifice one and then check the intestine, the gut, and look at the parasites we found. Spironucleus used to be called Hexamita in large quantity, causing damage to the gut, causing risk of bacteria and causing malfunctioning of the gut. So the fish has less nutrients and has weakening, and the lateral line is the first, in this case of cichlids, to show erosion. Luckily, it's treatable. If you do it all on time, you can control the parasite Spironucleus because they can damage seriously. And so you have to treat as soon as possible with metronidazole. See my books how to use it. A secondary bacterial infection can appear because of those parasites causing damage and weakening the fish. And then eventually you have to treat with medications like furantoin or oxytetracycline. Ask your pet shop, ask your veterinarian or fish doctor to get more advice. And at the same time, you can help with a functional fish food like Dr. Bassleer Fish Food Lapacho that helps the fish into control and the repair with this kind of infection. So this is the specific video on hole in the head syndrome described in detail in the new illustrated guide. Go to my Patreon training where you learn how to diagnose fish and how to prevent diseases. So I hope this short video on this typical hole in the head disease that's being called so often of discus fish teaches you a lesson. And be aware, watch your fish closely. So when you see the first erosion of the lateral line, that you might take a sample of freshly collected excrements, and there also you can find those parasites, Spironucleus. Subscribe. Thank you for watching.